Well, good morning, everyone. Happy Wednesday. I just want to let everyone know we are recording this meeting today. We are recording more lately to have these information sessions uploaded onto our website so you can go back and look and find information. Also, when I sent out the letter that I believe everybody got, the link in the letter was wrong. It seems like it doubled. I don't know what it did, but I put the link in the chat. I may have to re-put it in because I put it in before we started. So I will add the link to our annual child count page on our website so you can have that information and we could correct the link. So when I have my PowerPoint on, I don't really see everybody's, but if you have any questions while we're discussing the annual child count, feel free to interrupt me so we can deal with questions, because I'm sure if you have a question, then other people have a question as well. So I just want to welcome you to the annual Joint Steering Committee meeting. It's been a whole year around the sun again, so time is just whizzing by. This year is a little different from previous years, as you can see by the letter that we sent out to each of you, just that and we'll get into the discussion about the abbreviated forms. So this meeting we have Connections Beyond Sight and Sound is the Maryland and DC Deafblind Project. For those of you who may be new to this meeting, I think it would be great too if we could all just kind of put our names and our titles in the chat box, and then we can kind of like see who's here. Maybe for any new members, people that are on the in their local county and on the steering committee meetings, that they can kind of see who's here and network if needed. I think that would be a good start, just to kind of put everybody's name and their title, possibly their county, in the chat box. That would be great. So this meeting we have every year, and it's important to our grant outcomes because it helps us meet the need of collecting our annual child count for the state of Maryland. We also do collect the census information for DC public schools as well. Sometimes they join us, sometimes they don't, but we are the Maryland DC Deafblind Project, so we're charged with kind of maintaining both of those child counts. This is a mandatory criteria from OSEP, the Office of Special Education Programs, and a part of our grant responsibilities. Okay, just want to review the agenda for today. We're having an abbreviated meeting as well, just so we can go over the annual child count, and then we're going to have Dr. Paige Bradford talk about eligibility, and then we're going to do some sharing among us as a group. If anything is something great that you want to share, information sharing, something positive, any new changes that you need to share with the group is more than welcome to share at the end of the meeting. So I want to just begin by, especially for those who are new, I know for people that I've been with for over 20 years, they're probably tired of me saying, hi, I'm Donna Riccobono. I'm Project Director of Connections Beyond Sight and Sound. I'm here with my team today. Jennifer Willis is Project Coordinator. We have Dr. Becky Hammer, who's our Education Specialist, and Dr. Jennifer Stepanek, who's our Second Education Specialist. And on our website is a bunch of information about who we are and what we do. And you can reach our website. I think I provide that at the last slide. So it's marylanddb.org. And, it really describes the things that we do, between everything from technical assistance to schools is really the heart of what we do, which is that modeling and coaching and professional development and training, to statewide trainings where we host a statewide training on a topic, and we have people come either virtually or face-to-face to talk about a specific topic and learn something new about a specific topic. And then we like to follow up in those counties and see how they're doing. So all the different information and resources, I think I'm pretty proud of our website. I'm really proud of our archived webinars page. So there's training if you aren't needing us for a referral for us to come in, at least there's trainings that are online. on our archived webinar page. And we also have a YouTube channel as well that you could access with podcasts and more webinars. So we are always hoping to build capacity. So we are putting it out there for everybody as a free resource. And the trainings are typically an hour, hour and a half. Sometimes there's 1, 2, or 3 parts to a series. But we have a lot of our favorites and rigorous trainings that are already there. They're online archived for everybody to view. Okay, so let's get after it. Okay. The Maryland and DC annual child count. So our census for this year, each county should have received an email, like I discussed already. The email contained a link, and the link is not correct. So I put it in the chat box, but if I have to do it again, I will do it after this presentation because I can't see anything when I'm in presentation mode. And my laptop is 10 years old, so there's that. It really just talked about the assistance that's needed. The deadline to return it is March 11th of 2026. I attached a list of students that was previously reported. For any new students that you would like to add because maybe you have a new student in your county, maybe you've just discovered that maybe a younger student has both vision and hearing challenges. We have a new student child count form, and that is also on our website as well. I provided links and information about what is on our website. So this way you didn't just have a bunch of things attached to the email. I think it might make it easier, but I'm always willing to send it to you directly if you have trouble accessing the website for whatever reason. Just know that the new student child count form is for students that need to be newly added. It's not something that you need to do every year for every student that's on your list. So if they are already on our census, they're already in our database, they are already part of the annual child count, then we are good. You just maybe confirm that they're still at the same school because you know there's always a lot of changes. And you just let us know if they're at a different school. Maybe their birthday needs correcting, you know, whatever it is. And then you just let us know based on the form. So no need to fill out a new child count form for each student. I don't want to give you more work. I want to make this as streamlined as possible for everybody because we do appreciate your time and your effort on this child count. So we thank you for that. So again, on our website, we have a lot of the facts. We've got a lot of information that we're going to be discussing today is on our website. So please feel free to use that as a guide. We made it as user-friendly as possible, but if you still feel like you need to reach out to me, feel free to do that as well. I hope everybody got their abbreviated list. We didn't send the big packet this year. We just felt like we were as up to date as we're going to be, and we have a lot of different things happening this year. So we just wanted to make it easier for everybody to just check the list, review it, let us know, and send it back. So again, we thank you for your efforts last year. And again, we thank you for this every year because we appreciate it. Otherwise, it would be very difficult. We know from other states that are in the Deafblind Network, they struggle to have the annual child count that we have. So we are grateful for that and grateful for you all that you're willing to participate in this and fill it out and let us know because it is part of what OSEP is looking for and how they figure out their data and information and what the needs are around the country. Okay, so with that, what is the annual child count for children who are deafblind? And if those could just mute their line if you're there, just so we could make sure the interpreters can hear the information. Just make sure you're muted. Okay. So what is the census? So we conduct an annual child count of all children in Maryland, DC who have vision and hearing challenges from birth to age 21. And this information is confidential. Only the specific data is submitted to the federal government, such as maybe the diagnosis, the etiology, whether it's Usher syndrome to Charge syndrome to some type of illness after, maybe meningitis. So these are the things. And there on page 1 of the new child count form, there's a list of syndromes and other diagnoses that lead to children having vision and hearing challenges. So we can get into that a little bit later, but just know that that could help as a guide if there's a question if the student should be added to the list or not.
There you go.
Okay. Welcome, Olivia. If you could just mute your line, that would be great. Thanks, Olivia. Okay, so the data is compiled again, and it's sent to our National Center on Deaf Blindness, and they compile all the data from around the country and send it over to OSEP. So we know, I think all of you know, if you've been with us for quite some time, we know that students who are deafblind might be a low incidence disability, but they are high in support needs. So we try to support you all in building capacity and get in there as early as possible so we can provide problem-solving strategies, evidence-based strategies, so the whole team can feel successful, build that partnership with the family, and make sure that the student's needs are being met, that the student has access. So we are your partner in this. You're not out here alone doing this. Okay, so why is the annual child count so important? Well, I mean, the first thing is early identification. We really want to introduce strategies to students as young as possible. I think you all can relate to that. That early identification is imperative. So these children really need to learn these strategies to be able to have access to their curriculum, their peers, be able to communicate with their families. So these are all very, very important strategies that need to be implemented as early as possible. Also, many of our students, no two students are alike, so we want to get in there also not only as early as possible, but provide that individualized instructional strategies we need that needs to kind of be developed for each child. If these strategies are utilized at home as well as in the educational setting, then this can mean a significant improvement in the quality of life for these children and youth. So we used to tell everybody that, well, if we had accurate numbers, maybe the child count would help us get more funding. I have never found that to be true. I think that OSEP wants the information, but I don't think that it's a thing that's, oh, well, if you have 20 more added students. I have heard of a few projects that have gotten more funding, but I think there's multiple reasons for that. But again, it is important because we want to be able to collaborate and build that capacity with each of you. So I would say that the way that this is used mostly is between our national network and OSEP. They are identifying the technical assistance need, and also they are keeping track of the syndromes and the diagnoses. So all the etiologies of these kids, they're kind of compiling and seeing if there's an increase. And I can tell you in Maryland, there seems to be an increase in CHARGE syndrome. There has been a decrease in Usher syndrome, and that seems to kind of all of a sudden now there's a couple of new students. So you never know. It's good to keep track so we know maybe we as a group, as a project need more information. We want to make sure we're meeting the need of the educational team and the family. So it's good for us to know as well. So what is meant by the term deafblind? So there is a federal definition, and it talks about the combination of both at being educationally impacted. So we're talking about the combination, which creates severe communication needs, other learning needs that cannot be appropriately educated without, with just a teacher of the deaf or a teacher of the visually impaired and blind. It's like a combination of both. Sometimes when we do trainings around introduction to deaf blindness, we talk about it's not deaf plus blind, it's like deaf times blind. So it's just that overall impact of these students, making sure that they have access. So the federal definition is on our website as well. Our national center uses it. I would say that we need to just be mindful of students also that have multiple disabilities. And Dr. Paige Bradford is also going to talk about this today, but those students that have multiple disabilities, if they also have vision and hearing challenges, maybe we're unsure, they're at high risk, maybe we check their diagnosis, their etiology, and we kind of look back and say, oh, well, maybe we're unsure, but we don't think that he's using the functional vision or hearing as well as he could be. Maybe something's going on. So we're here to support with those students who are high risk as well. So we want to get in there and just talk about access, specialized adaptations, modifications, and strategies. So when interacting with the child, is the child eligible to be included on the census and receive services from the project? Does the educational team would like services from the project? And I think the way that we have reconstructed our website is that there's different levels of technical assistance. You don't need to say, all right, well, I need to fill out a referral form to get information, because you could access our website and there's a lot of trainings that are recorded and archived. You could read some of the information for educators, for families around interveners. You may get a lot of information and a lot of your questions asked just by reviewing our website. So we made it that way. So not everything needs a referral form, but we, of course, are happy to partner with you to provide that technical assistance to you all and come in and really help problem solve and provide that quality of service. So keep in mind, I know a lot of you have heard this already, the child does not need to be completely or profoundly deaf or blind to receive services. It's really a degree of functional vision and hearing loss. So it doesn't matter, one way if they're categorized as multiply disabled, or maybe they're even labeled as deaf, hard of hearing, but now maybe there's a vision loss, but we're not sure, and we can help, of course, go in and help the team with that as well. We are still providing services around orientation mobility assessments. We're still providing services if the county needs a functional vision assessment completed on a student, and you also think the student has a vision and hearing challenge. We are happy to help support that, and because we know that time, sometimes runs out, and we're here to support the counties with that, being charged with that as well. So let us know if there's anything we could do around that. I think children who have that brain-based, that neurological visual impairment and hearing impairment, of course, we include those on our annual child count. So be mindful of that as well. And if that's something that we need to discuss further or provide a professional development on, we're happy to do that. So in addition, all infants, toddlers, preschoolers who have vision and hearing challenges need to be identified and represented on the annual child count. This includes all children who are at risk or experiencing developmental delays. Children that are at risk may stay on the annual child count, and we can monitor them and we can help identify others. So it's whatever your team and your county may need from us. Okay, so once again, what if hearing or vision are cortical in nature? So we've done a lot of work with Dr. Christine Roman, Lancy. We've had trainings. We have statewide trainings. We included you all in that. And so we are here again to support. So a functional vision assessment, the CVI range is a part of that if needed. So we are here to support students who may have neurological visual impairment. We can discuss the characteristics that we're seeing, or we can support by saying these are the characteristics, but we know that the medical diagnosis needs to come from a medical doctor. So any support that's needed around this, because we know that sometimes it can be tricky business, but we're here to support you all with this as well. These students usually require adaptations and modifications to their program, as you know. In addition, the hearing and vision problems may be considered when developing effective communication program for these individuals. So we have this wonderful document on our website that was Jennifer Willis was the co-creator of the AAC CVI matrix. And this really helps a team put it together. So if you have a student that you implement the communication matrix and the communication matrix shows that the student is on level 2 out of 7. And then you have someone complete the CVI range, and you find out, well, the CVI range says there may be scoring an early phase 2 or a late phase 1 student. Then that guide, this AAC CVI matrix that's on our website that you can download and use, will help put those two pieces together and help the team decide where to start, especially for more specifically in communication. So we know that students who are entering early phase 2 on the CVI range may not be able to see those salient features of picture symbols. So it kind of gives a healthy place where we can start with a student and build on their communication program. So this is providing that information. This is a guide for teams. And if you need assistance with that, of course, we're here to help. Pretty much all of us on our project has extensive training in neurological visual impairment. So feel free to reach out. Again, we know sometimes it can be tricky business, and we like for the team to have the most reliable evidence-based information as a baseline to bounce off of. So that's how we try to help you all do that. So including a child on the annual child count, does it obligate the school program to provide services such as a TVI or a teacher of the deaf hard of hearing or orientation mobility specialist? And the answer to that is no. We know that sometimes a student may have a diagnosis such as CHARGE syndrome, and they are at high risk, so we will keep them on the annual child count, but it doesn't mean that we dictate those services. Always and continues that the IEP team decides what is appropriate for the students and the services the student receives. So we do not dictate that. We can help consult and advise if you ask, if you feel like you need that information. But we know that even younger students with CHARGE syndrome, again, not every 2 students are alike. Every student is so unique and different that they may have very good use of their functional vision, and maybe they just need more time processing. Their brain needs to interpret what they're seeing. So we're not saying that they need a teacher with visually impaired, but we are here to just guide the team and say, well, just give them an extra 10 seconds to take a look at this so they can process the information before moving forward, so the student has all the information they need to have access to what's coming and what we're expecting of them. So, but we do not obligate services. We do not tell a school system how to do that or what to do. We advise, we give you information, we try to make it evidence-based and research information, and then we let the IEP team decide what to do next. Of course, if your local county or your local school would like an in-service from us to even discuss introduction of deafblindness and talk about all the different scenarios and the different kiddos, we are happy to do that. We've had some questions already so far this year. I think I sent it out I think I sent it out last week, but the questions on the annual child count, if again, is the student not receiving services, and I think so if they're on our list, it's because they have something, their etiology matches the page 1 of our child count form. So they have something that they're diagnosed with, like CHARGE syndrome or Usher syndrome, even though their vision or their hearing may be functioning pretty well. We know that things can change. We know that there's slight differences. And so what we're saying is if they have the etiology that matches our annual child count form, they should be added to the list of students in your county that has deafblindness or they are at high risk. So we monitor those as well. Our database is very old. We do not have the funds to update our database. So everything is completed on one list. We cannot separate and divide it out. It is basically just because we're working with what we have. And, we're trying to make the best of it for this year. So just know that if you have a question about if the student should continue on the annual child count, be removed or you have somebody to add, we're always here to help kind of figure that out with you all. And what happens if I don't know all the information that's requested on the census form? And I think because this year we gave you the abbreviated form, it shouldn't be as complex. Excuse me. I think that we really are just looking for that accurate count of students, that list, and to just double check. I feel like we really worked hard last year with all of the data that you all gave us. And I feel confident that our annual child count list is pretty solid. But again, we can continue to discuss kids that you have questions about. We could add kids at any time. It doesn't always need to be this time of year. So if you have questions or need some assistance, again, we can help with figuring out if the child needs to be added. So who should complete the annual child count, the census form? If you're here today, it's probably you. So, and you're listening to this presentation because you're probably the one that's going to fill out these forms. And again, this year we really provided a abbreviated list, not to make it so complex for you all this year. You did a great job last year. If the county that you're working in says there are no students, we could also meet and discuss what it looks like when a student may have vision and hearing challenges, just so you have a different picture of the student who may be functioning pretty well, but we're here for supports if needed. We're always, again, we're always available to do an in-service virtually even, or just have a discussion online just to discuss the spectrum of deaf blindness. As most of you may know, there's a difference between the annual child count versus the referral form. The referral form is where you are asking for us to provide technical assistance to an educational team. That requires an administrative signature plus a family signature. It's a 2-page form on our website, and it's asking for our assistants to come in. We still get about 15 to 20 referrals per year, and we're happy to support the education team and provide anything from making materials to professional development, working in the classroom, doing observations, providing assessments, whatever is needed. The annual child count is what we're talking about today, which is separate from the referral form. And there's a whole page dedicated just to the annual child count on our website. And hopefully that is in the chat box, is the corrected link. And if anybody has any questions about the difference between those two forms, always just reach out and ask. Again, so how is the information used? I think that I touched on it before. It's really about the National Network on Deaf Blindness, kind of compiling the data from around the country. The information, it also helps us to plan for appropriate trainings. If we're going to provide a training on Charge syndrome, it's because we have a very large caseload of students. We're not going to provide a training if it's not pertinent to what our needs are in the state. So it does help us kind of guide our training and also help us with our grant outcomes. So we try to be very mindful about that information. And once a child is identified, the project can then initiate and respond to any requests for technical assistance and training on behalf of that student and that student-centered team. If there's any information that I haven't touched on or you feel like there's any questions, please feel free to reach out to us. I think you guys do a really great job of that. But for those who are new to us today, that we're always here to respond to questions about the annual child count. And again, the page on our website really kind of dissects it and gives you the Q&A around all the information I think you might need. But if there's anything else or you just feel like you need to talk it out, we're here for that as well. Okay, so I already touched on that, and I'm going to say here's our website page. We also have a Facebook page as well. Again, our website you can find also the YouTube channel, The YouTube channel has also more archived webinars, and it also has podcasts that we've been doing, and I think the podcasts are really cool. They're only about maybe 20 minutes long, and we are highlighting a specific topic, whether it's a family interview or a service provider of some sort. So we're highlighting that. So yeah, check it out. And if there's anything, use it for trainings in your county, use it for professional developments. I think our goal is that we hope that it's helpful for you all. We're trying to make something that's helpful and user friendly, that people could access at any time, rather than feeling like they have to fill out a referral form. We are always very busy. We are a small group. There's 4 of us, but we are mighty. And we try to really answer and respond as quickly as we can, especially for those counties who are would like and requesting a assessment of some sort or referral form. So we do try to be mindful about time and make sure that we are responding to your requests. Okay, so I'm going to make sure that the corrected link is in the chat box. I'm also going to check the chat box and make sure that there aren't any questions, or feel free to chime in if there's any questions at this point. I'm going to stop sharing my screen, and Dr. Paige Bradford is up next, and she's going to talk about the eligibility form. But again, feel free to jump in if there's a question before Dr. Paige Bradford gets on. I think we need, Jen Willis, we need to make Paige a co-host so she can, if she has a PowerPoint to share or anything like that.
Got it.
I promise not to abuse the co-host powers. I'll keep myself in check. Did you want me to wait a minute to see if anyone has any questions before I get started?
I think people are pretty familiar, so I don't think this is new information for people. So I'm going to say if you want to just kind of keep it moving, I think we're okay.
Okay, perfect. Well, I think I already know everyone here, but I'll just introduce myself anyway. My name is Dr. Paige Bradford, and I'm the Section Chief of Specialized Instruction in the Division of Special Education at MSDE. I also am your Vision Steering Committee liaison and your Deaf and Hard of Hearing Steering Committee liaison. And I serve as the PI for the Deafblind Project. So I work closely with Donna and Jen and the rest of the team. I say all that to say that I wear a lot of hats in this job. So, this project that I'm about to talk to you about is something that we're really committed to at the agency. And so it's going to be really critical that we're able to get feedback from everyone today, but also that we're able to move things forward in a way that makes sense. So I'm going to just start by giving you kind of a brief overview of what we're doing, and then we can talk specifically about the deafblindness component of this. So at the agency, as many of you may already know, in the fall of 2023, we released the Intellectual Disability Checklist. And this checklist is required for use for any IEP team that is considering identifying a student under the federal IDEA disability category of intellectual disability. Part of the reason why we did that is because we, across the state, in a number of disability eligibility categories, have over-identification of certain groups of students. So for some of these disabilities, it's Black or African American students. For others, it's white students. For others, it's Asian students. And so one of the things that we've committed to doing is developing a disability eligibility checklist for each of the 14 IDEA categories to support LEAs as they're considering those different disability categories. So that's just kind of a overview, a holistic view of the work that we're doing. In terms of where we are with the other disability eligibility categories, I do just want to kind of briefly go over that before we get started. So this year, for the July 2026 release, We anticipate that we're going to be releasing a new specific learning disability checklist. So there's currently a form that is required for use. This new checklist will replace that. We also plan on releasing the speech language impairment, the visual impairment, including blindness, the deafness, and then the hearing impairment checklist this July. And so you guys already know because we've been working with you to create some of those checklists. Then for July 2027, we anticipate releasing the emotional disability, deaf blindness, orthopedic impairment, and multiple disability checklist. So that would be not this upcoming July, but the July after. And then for July 2028, we anticipate releasing autism, developmental disability, other health impairment, and traumatic brain injury checklists. So we are gradually rolling these out, and there's a few reasons for that. The first is that we want to make sure that they're usable. So we're incorporating a lot of stakeholder feedback. So for example, for the traumatic brain injury checklist, we're working with the Traumatic Brain Injury Advisory Board to make sure that we're really capturing the essence of both the legal definitions, right, in IDEA and COMAR, but also we're getting practitioner feedback from physicians and other people who are very familiar with traumatic brain injury. So I say all that to say it is a process. Um, what we're looking for today, and you are more than welcome to send me an email now with your checklist if you have one, or we can just kind of talk about it. But what we're really looking for today is to talk about what might we be looking for in a deaf blindness eligibility checklist, what would be critical to include, and then if you have a checklist for your LEA, which I do have one that was sent to me, are there components of it that you think are not helpful or should be changed. And that's kind of what we're going to do today during this time. And I'm just going to take notes with what everyone says. And then at next year's joint meeting, we'll bring a draft checklist for everyone to share some feedback on. And then that will put us on track to release it that next July of 2027. So are there questions about this? Okay. So I did receive one checklist, like I mentioned. So I'm gonna just go ahead and talk through what it includes, and then we'll kind of go from there. I can also share my screen, I think. Yes, okay. All right, so this is one of the checklists that was submitted, and we can use this kind of as a starting point for where we want to go. So this checklist obviously includes student demographic information. We'll include that in our checklist as well. So it will look the same as the beginning of the intellectual disability checklist. It's going to include all the student demographic information, which we're hopeful will auto-populate, and then their current disability eligibility category or initial. So that's kind of the way the beginning will look. This checklist has those three questions. So the first question talks about what the definition of deaf blindness is, that simultaneous hearing and vision impairments. And then the second talks about, is there documentation of deaf blindness? So it asks for two other worksheets to be included, right? So the visual impairment, including blindness worksheet, and the deafness or hearing impairment worksheet. And then it really talks about the IDEA definition of deaf blindness, which is that the combination of hearing and visual impairments create needs that can't be accommodated in programs solely for children with deafness or children with blindness. And that's kind of the whole of the checklist. So I'm hoping that either if people want to put their checklist in the chat so we can kind of look at them. And then I'd really like to open it up for people to come off mute and talk about what do you think would be really important for us to consider when we're including a checklist. And I'll just take some notes.
This is Olivia speaking. I couldn't find my hand raised, and I apologize. I was having technical issues before, so I apologize when but I think, do we have the corresponding checklist for the visual impairment or for the hearing loss or for the one that we're looking at? Because to me, we just need documentation of the hearing loss and audiological evaluation.
Yes,
Okay.
we do have, they sent all, I actually have all the worksheets for this
Okay.
LEA. So
Okay.
I can go ahead and, I think I have the ability to upload in the chat. Let's see.
Okay.
All right. So I'm uploading them all. Oh, it's too big. Hold on. Let me see what I can do here. Okay, let's try that. If everyone wants to kind of take a look, there we go. Okay. And peruse. The deafness checklist is on page 3. And then the their hearing impairment is on page 5. And then I'm going scrolling down to find what page the vision impairment is on. Visual impairment is on page 14. So if you have a checklist from your LEA, you can feel free to put it in the chat. Um, this is just the only one that was sent to me, so it's not an end all be all. But I think it's just a good place for us to start to talk about what we think would be critical to have in the state checklist.
Paige, this is Liz Nerbos. I am the Vision Instructional Specialist in Montgomery County. I'm looking at the visual impairment, including blindness worksheet. Where did you get the visual acuity?
So this is an LEA's checklist that was sent in. So this is not the statewide checklist. We had sent out an email asking for everyone to send in their checklist if their LEA has it, and this is the only one that was sent in.
Okay, because we don't have a correct definition of blindness on this checklist, according to COMAR. We're not using visual acuities, best corrected, things like that. So that,
Okay, yeah. So that's something when the Vision Steering Committee is making the visual impairment, including blindness checklist, that is really good information to include there as well.
okay, thank you.
Mhm. Yeah, if you have a checklist from your LEA, please feel free to put it in the chat so that we can kind of look at it and talk about what would be critical things to include in the statewide checklist.
Hey Paige, this is Lauren from Anne Arundel County with Vision Services. Did you receive the one we worked on with the Vision Subcommittee?
No.
Okay.
So I know one of the things that Olivia mentioned was that it's really critical that there's documentation of some sort of hearing loss, whether it's the child's deaf or hard of hearing, but that we need to have that documentation. So one of the things I think we should think about is, do we want, and this is a question question, I don't have a specific preference. Do we want people to also do the visual impairment and the deafness or hearing impairment checklist in addition to deaf blindness? Or do we want it to stand alone? Right? Because we could make this checklist and we could say there's documentation of deaf blindness. Where's the documentation that there's a visual impairment? Where's the documentation that there's a hearing impairment? Whether that's, the functional vision assessment or whatever it is. But it doesn't necessarily have to mean that they would have to do all three of those checklists. But if that's what the group prefers, we could certainly structure it that way.
Hi, this is Samantha, the supervisor of hearing and vision services for MCPS. I'm just wanting to clarify, since I am brand new, that these checklists are not like concrete yet for July's release for like deafness, hearing impairment, vision. Am I understanding that correctly? This is just one example, right?
Right. So we asked LEAs to provide examples, and then the Vision Steering Committee is coming up with a visual impairment, including blindness checklist. And the Deaf and Hard of Hearing Steering Committee is coming up with a deafness and a hearing impairment checklist. So this is just what one LEA submitted. We had asked to please send your deaf blindness checklist in advance of this meeting. And so I was just sent the entire packet from this LEA of all of their checklists. Which is fine. That's totally okay because we are
Awesome.
updating all of them anyway.
Yeah. Thank you. That's
Of
provides
course.
clarity.
Again, this is Liz from Montgomery County. I think that the deaf blind checklist should be separate. I don't think, because it is a separate disability category, I think that we should have it separated. Hearing, deafness, and then deaf blindness. Yeah.
Yes, it'll be separate. It's going to be its own. Each of the 14 IDEA disability categories will get their own checklist.
Oh, okay. I thought you were saying you wanted to combine them. Okay, sorry.
No, so my
Okay.
question is, if you look at the first sample one that we have, under documentation, they say you have to have completed the visual impairment, including blindness worksheet, and the deafness or hearing impairment worksheet. So that's one way that this could be structured, right? It could be that you have to complete both of those in order to do the deaf blindness worksheet, or the deaf blindness worksheet could stand alone, like it looks like the one that was just uploaded by Lauren for Calvert. It looks like that stands alone, right? You go through and each of the questions, it asks about hearing loss, it asks about vision loss, but it doesn't say, and also make sure you did these other two checklists. Yes, they're going to be separate, but Lauren, I think the question is, if you're considering a student for deaf blindness, do you require them to also do the deaf or hearing impairment checklist and the blindness, including visual impairment checklist? Oh, yeah. So go ahead, Olivia.
No, I was gonna say we don't. So if we have the deaf blind, because like Liz said, from Montgomery County, that's its own separate category, then we wouldn't do the other two. It would just be the one. Yes.
Okay. And does everyone kind of feel the same about that, that it should just be that one checklist and we'll just need to make sure that all of the documentation is included as opposed to having to do 3 checklists total to find the student eligible?
This is Lauren from Calvert County. I agree.
Okay.
Yeah, this is Liz from Montgomery. I agree.
Stephanie from Baltimore City, I agree.
I guess the question.
Can I add a question, and that is on the form that you were showing, unilateral hearing loss is not listed. And so I'm just tossing that out to the group as another consideration for those students because they would qualify for hearing impairment. So if they have
So
vision impairment as well, I mean, I'm just tossing that out because we are getting a lot of, I know we have one student who has, Lisa, you can check me on this, but has vision in one ear and blind in the other. And then, but also is deaf. So they've qualified.
yeah, so I mean, I think that's really up to the steering committee for how you want to go through that process. Because the Deaf and Hard of Hearing Steering Committee is making the deaf and hearing impaired checklists. And so if as long as it meets the legal definition, right? The definition in IDEA and the definition in COMAR, then when we send it to our AAG, it'll be approved for legal sufficiency. What we can't do is like create other requirements that are not somehow rooted in regulation or guidance from the US Department of Education.
I don't know if anybody else has any thoughts.
I have a question. This is David from Howard County. Just for again, like Lauren said, we really don't have a lot of cases where the students that are being considered for deaf blindness. But when we're considering that deaf blindness, would a student qualify for that with any type of hearing loss?
So under the legal definition, they could, right? Because the legal definition specifically talks about placement, which we could kind of go back and forth about whether or not we, all feel like that was what makes sense. But the legal definition says that their needs are such that they cannot be met in a program for students who are blind or visually impaired or deaf or hearing impaired. That's what the legal definition kind of categorizes deafblindness as.
Okay, I just wanted to clear that up because if we have a kid that's like had blind in both eyes, but minimal hearing loss in 1 year. Like if that's, I don't know, I just wanted to tease that out because that could be a case that comes across, and do we consider that kid as a deaf blindness, or do we just look at like different disabilities? So I was just trying to throw that out there because I just wanted to be clear that, all right, if it's any type of hearing loss, we can consider deaf blindness. And if that's the case, then we need to have some type of documentation for that on the eligibility page.
Okay. Yeah. I think that makes sense. What thoughts do others have?
This is Jen. I'm just wondering if if this eligibility form should include any kind of considerations regarding the other areas of impact or the other areas of learning and development that can be impacted by dual sensory needs, just for when this criteria or when this eligibility form is being used to determine if a child is going to be identified as deaf-blind as the primary disability code versus, say, other health impairment or multiple disabilities, if they have other needs or challenges, just looking at how some of those other areas of development, communication, social, possibly even physical, depending on the vision, can be impacted by that dual sensory need, just to help the team determine which way to go. I don't know your thoughts on that.
So at the bottom of our ID checklist, we do have something in there that specifically says like what areas are impacted and they note which areas are impacted. But I don't think it's a bad idea to I don't think it's a bad idea to ask the question of like does like some question, I don't know how we would frame this, but something about like is deafblindness the primary fitting IDEA category. I think we would just need to be careful about how we frame it so we can stay within the bounds of the regulation. Go ahead, Olivia.
Hi, this is Olivia speaking. So, in IEP meetings, when we're considering eligibility, we sometimes talk about all the potential categories. So I know in meetings I attend, we'll say, we're looking at Pacific learning disability, hearing impairment, speech language impairment, and we actually list that at the permission to test meeting because this is why we're testing to look at. So I think if you have a student with concerns with developmental needs or that could be part of that initial discussion of these are the different categories of eligibility we might be considering. And then when you review the testing, then you can say, you know, based on those results and the information from the teacher and the classroom and different things, what might be what we consider the primary disability because I think that would help wean that out. But I think that's an important factor to consider when you're looking at eligibility for students who may have the sensory impairment, but also may have additional impairments.
Yeah, I think that makes sense. Does anyone have any other thoughts or suggestions? So as we kind of go through this process, if you have a deaf-blindness eligibility worksheet or checklist, it would be great if you could share it with us just so that we can kind of see what other LEAs are doing. And certainly I'm always open to any feedback that you have to share or anything as you're kind of thinking about this or sharing with colleagues about this project. But if there are no other comments, I'll go ahead and turn it back to Donna.
Okay, we good? So it looks like we're going to get finished a little earlier today, but before we do that, I want to open the floor to everyone if there's something you'd like to highlight, something you'd like to share that's happening in your local county. Feel free to share that at this time. I know that the Maryland School for the Blind would like to share something if they're available. I know it's a little early, but it's up to you.
I'm calling her to see if she can get on.
Okay. They have some good news they'd like to share. Does anybody else have any positive, uplifting, good news to share going into our holiday season?
Donna, this is Liz again from Montgomery County. I just wanted to thank you and Jen for coming out to our county and doing that assessment. Your support is invaluable, and we just want to give you a shout out to say thank you very much for doing that.
It's our pleasure. It was actually me and Becky. But
Oh,
yeah.
Becky, I'm sorry. Jen, I thought Jen came. I'm
Jen
sorry,
is
Becky.
there too. She's around. She's
Yeah. Thank you, Becky.
We can't keep track of where Jen Willis is. She's everywhere. So, but yeah, Becky and I had the privilege and the honor to go in there, and it was great.
Okay, so hi everyone. It is DC from Maryland School for the Blind. I have invited a special guest in to talk to everybody all at once, and she'll return also just for the vision steering later this afternoon to talk again and answer any more in-depth questions the vision side may have. But I wanted to take an opportunity to introduce Heather Connors, our brand new low vision therapist at Maryland School for the Blind, and some of the awesome programming that she is working on putting together.
Hi, everybody. My name is Heather Connors. I'm a certified low vision therapist. I just started at Maryland School for the Blind last month. Before that, I was at the Wellmore Eye Institute Low Vision Clinic as their certified low vision therapist. And we are trying to get the low vision clinic here at MSB up and running as quickly as possible. So I know that there were some referrals previously trying to get kids in for the low vision clinic. We are going to try to streamline that a little bit so everything just comes to me for a very quick, kind of almost like a dump of getting me as many kids as possible so I can just start making those connections. So I am going to put a link for a form in the chat in just a second. This is just going to be a short-term form to get me in touch with some of the kids that might have been waiting for some time. And then the goal is to go back into the original outreach form quickly. So we do not have the low vision clinic up and running yet, but like I said, that is the goal, to get that running as quickly as possible. Let me see if I can. So I just put the link in there for the form. This is really just going to be if they need to come to the low vision clinic, if they need a refraction or not. If they do not need a refraction, it's going to be really a technology assessment or a device assessment for optical and digital. And then if they need a refraction, we do not have an optometrist currently, but I will contact the families and see if they have insurance benefits, if I can help coordinate with getting them with a low vision provider or a pediatric ophthalmologist, or some of the county might have some services that we can help connect them to for refraction through the county while we're waiting to get an optometrist here at MSB. So that was my very quick overload. Any questions right now?
Questions, comments, or concerns? And like Heather said, that referral form that she put in the chat is just to kind of like jump ahead of, instead of using the regular outreach referral that comes to the whole team, we review and then we send it out, it would go straight to Heather and help her prioritize where we need to put the clinics and which clinics need technology, and what type of refraction need is there for an optometrist, because remember, the CLVT cannot diagnose. We can offer technology and optical, non-optical solutions, but there is no confirmation of diagnosis without the optometrist or ophthalmologist. But we are working to get one. It is in legal review. I just didn't want to hold anybody up if they really need that technology, telescoping evaluation or anything like that. So it's in the chat. I will post it again during the vision, and we will make that available in the meeting notes as well. Thank you, Heather. Heather, can you remind everybody what your extension is and your email address? Can you put that in the chat for everyone? So if they have any questions, they can reach out to you directly.
Yes. So I just saw the question about the spare glasses. It is something that I've talked to the social worker here at MSB about. So there are some other resources that we might have. I have a list of them. So if you want to contact me, we can discuss some of those options. if they do have insurance and they are a minor, sometimes they actually have better benefits than adults under the insurance. So we can also look at those types of options. Oh, and I put my stuff directly to, hold on one second, guys. There we go. So we can definitely look at some other options for the students.
Any other comments, questions, or concerns for Heather? All right. Thanks so much for popping in and meeting everybody really quick.
Thanks, everybody.
Thank you. Great news. Anybody else have anything they would like to share? Anything from a committee as a whole? I know there's a lot going on with both committees. If anything you would like to share at this time before we break? Go ahead, Olivia.
Hi, it's Olivia speaking. Okay, DHA Steering Committee. We will still start our meeting at noon. That way you have a chance to eat lunch and take care of everything. That's why we started noon. I just want to share that with the group since we ended a little bit early.
Well, if there are no questions, I want to thank everybody again for joining us. Remember the annual child count. It's due March 11th of 2026. I wish all of you a wonderful holiday season. I thank the interpreters today for joining us. Thank you, Dr. Paige Bradford. Thank you, committee members. I wish you all a great rest of your day. Reach out if there's any questions. Yeah, it's okay to stop the recording.